Hello everyone and welcome to Nick Barlow Radiology, and in this latest episode we're going to be talking about the aortopulmonary window and how it can help us to determine if there's any mediastinal pathologies. So what we'll do is we've got a normal chest first of all. So if we zoom into that, we're talking about this region here, guys. So I'm going to draw on there so you can see it. We're talking about this area. Superiorly, we've got the inferior border of the aortic knuckle here. We've got the superior border of the left hilum inferiorly, and we're looking for this kind of concave shape. If it's straight, it's also determined normal. If it's the same on previous x-rays. So having previous x-rays really helps us with this, guys. And one example of that is if we come out of here, let's just get rid of that. If we look at this example here, one thing we've got to be wary of is unfolding of the aorta, and you do get that quite commonly in more elderly patients. And if we can see here, we'll put the faded arrows on this, but you can see we've got the aortic knuckle there, but the aorta is actually folded outwards. This is the lateral border of the aorta coming around there, and the aortopulmonary window's in there. It's obscured by aorta, but it's normal for the patient. Okay, so we've got to look at if there's any previous x-rays, have a look at the shape of the aorta and determine if it's normal unfolding or if it's due to something else. Now, this is in this example, we haven't got any previous x-rays to compare. So a little bit more difficult. This patient presented with chest pain. And if we look down here, we can see we've got some infective changes going on. We've got some patchy airspace opacity in that right lower zone. So your eye's immediately drawn to that. But what you mustn't do is disregard everything else on the x-ray. Okay, so if we do our assessment of the heart, we can run all the way around it and it looks absolutely fine. But then when we zoom into this section, guys, here, you can see something's just not quite right there. So where we would normally have that concave shape, we've got this outbulging of soft tissue here. And that's not a normal shape. So you can kind of see aorta coming around here, and you can see a border coming down here, but we've also got this soft tissue here as well. So we've got two double interface of soft tissue there. It looks quite dense in this area here. And we've also got, if you follow the line down, we've also got here, you see, this is one border of the trachea. This is the other border coming here. This is the trachea centrally. And we've actually got this outbulging here, this shift in the trachea to the right. So it implies that something here, there's something adjacent to that trachea pushing it to the right. That, coupled with the fact that we've got increased soft tissue at the aortopulmonary window, raises a strong possibility that there is a mass under there. Now, that could be due to lymphadenopathy. It could be due to a malignancy. It could be due to prominent mediastinal fat, which is a normal variant, although not very commonly seen. It could be due to aortic aneurysm. So this patient will need to have a CT thorax in order to determine what's going on. But if we remember that aortopulmonary window, guys, it really helps, because if you just zoom out and look at this x-ray, your eye's immediately drawn to this area down here. And if you're not careful, you could easily miss this. You could easily miss this here. But knowing that you've got that usual normal concave shape of the AP window, remembering to have a look at that area, you clearly see that it's abnormal. So it's just another little area to look at that can help you with chest x-rays. Okay, guys, brilliant. So that's aortopulmonary window. It's only a quick video, that, but I hope you'll find it useful in your reporting practice. Please like and subscribe to the channel. Share with your colleagues, as always. Do appreciate it, guys. If you've got any ideas on future content, just drop them in the comments and I'll do my best. And look out for future videos on radiography careers. Right, guys. Cheers. Speak to you soon. Bye for now.